In this session today, I will be talking about cesarean delivery. Now, as we all know, a cesarean delivery is a way in which the baby is removed abdominally after an incision is made through layers of the abdomen. And where is this cesarean delivery required? First of all, the cesarean may either be an emergency cesarean or it may be an elective cesarean. So let's talk about elective indications for a cesarean delivery. So elective cesarean may be required, first of all, wherever there is some malposition. For instance, if the baby is breech, which means that the baby is presenting by the buttocks instead of the head. Then there is also when there are twin pregnancies or there are multiple order pregnancies like triplet pregnancies, especially when the first baby of the twin is presenting in a non-cephalic or a non-head presentation. Apart from that, whenever there is some placental problem, for instance, if there is something known as placenta previa or there is a low-lying placenta, then apart from that, in case you've had a previous cesarean and you have a malpresentation like for instance a breech position, some other malpresentations like an oblique lie or also a transverse lie can also require an elective cesarean. And there are some indications, for instance, when the doctor feels that the baby's head is too big for your pelvis, something which is called cephalopelvic disproportion. So some of the reasons why a cesarean delivery needs to be done electively are these, although I have not gone through all the indications. Apart from this, we can also have some indications which are emergency indications. For instance, whenever we've planned on a normal delivery, but then there are indications which happen during the course of labor which require the delivery to be done with the help of a cesarean. Now this could be whenever there is a fetal distress, which means that there is some problem with the heart rate of the baby. There could be passage of meconium that can also happen. Then we all know that most times we have a continuous electronic monitoring of the baby which is going on. In case there are non-reassuring fetal heart rate patterns which are there, the doctor may again talk to you about an emergency cesarean delivery. Occasionally, it also happens that if there is a failure of descent of the head or there is something which is known as dystocia, which means that there will not be a dilatation of the cervix which is happening, this also can lead to an emergency cesarean delivery, which means you're getting good uterine contractions, but either the head is not coming down properly or the cervix is not dilating. Of course, there are many times nowadays, and many studies which are now showing that, cases which were labeled as non-progress of labor actually could have also ended in a normal delivery had we been patient and had we waited. And apart from that, we do find also by studies that the progress of labor goes a little slower than what has always been said it would be. So basically, importantly, cesarean sometimes can also cause the life of the patient as well as the baby to be saved whenever there is a requirement in the form of an emergency. Now, how do we prepare for this cesarean delivery? First of all, if there is an elective cesarean delivery, the doctor will ask you to not have food or water for a definite period of time. Following that, you will need to come to the hospital. There will be some basic preparation which is carried out. You would be given some medication which is pre-medication in the form of an antiemetic as well as something which will take care of your gastritis, and following that you would be required to be wheeled into the operation theatre. So always remember that there are two kinds of anesthesia which are given. there is a regional anesthesia. Most of the times this is spinal anesthesia, which is very common these days. Or in case you've had an epidural option, that is also there. And of course there is general anesthesia, but most times these days, unless required absolutely in an emergency, most times there is a cesarean delivery which is effected with the help of a spinal anesthesia. So talk it out with your doctor, discuss how spinal anesthesia would be given. It is a very minute prick which is given into the spinal cord, and there we that is how we actually bring about the anesthesia part of it. So, and a medicine is injected inside after withdrawing a little bit of the cerebrospinal fluid. So once that is done, the incision is made, your baby is delivered out through an incision on the uterus, and following the delivery of the baby, the placenta, and then all the membranes as well. Then after that the uterus is stitched back, and the same is done with the various layers of the abdomen. Following the procedure, you will be required to lie down for some time. Then apart from that, you will be required to take some painkillers which are given most of the times round the clock, and every hospital has a pain protocol to take care of that pain. You will be required to take some IV fluids as well and some antibiotics, and then by the evening or so one starts you on liquids which are initially clear liquids, and then we of course switch over to a diet which is initially a liquid semi-solid kind of a diet, and then we go on to a normal diet. A catheter will also be placed during the time just before we actually do the cesarean, and this normally is removed the next day. You will be asked to move around, which is called ambulation, because early ambulation also takes care of a lot of problems. So now, why is it that we say that there are some disadvantages of cesarean? So the disadvantages of a cesarean section are that there may be a little more bleeding compared to a normal delivery. Secondly, it's also seen that there are more chances of infection. Infection could be in the form of an endometritis, it could be in the form of urinary tract infections, etc. Apart from that, it's also been seen that there will be more chances of thromboembolism, which means that there is increased clotting that can happen in your legs, and sometimes these clots can migrate. Compared to a normal delivery, there are more chances of thromboembolism also in a cesarean delivery. The recovery is definitely a little slower, and the pain will also be a little more compared to a normal delivery. And apart from that, some of the things which happen with the baby are that, normally when there is a normal delivery that happens, as the baby traverses through the vaginal canal, it picks up some of the bacteria from the mother, which are healthy bacteria and which are also going to give a lot of they will give a lot of immunity for later on as well, because this immunity would be in the form of immunity against respiratory illnesses, GI illnesses, etc. Of course, these days we say that skin to skin contact should be at the time of the cesarean delivery, even in the OT, but sometimes breastfeeding is initiated a little later compared to a normal delivery, which should actually not happen. So these are some of the problems which do come about with a cesarean delivery. Now let's also talk about some of the problems which the mothers face. I and a lot of other colleagues have also seen that there is some amount of a guilt which happens when a girl goes through a cesarean delivery, when she anticipated that everything would go along with a normal delivery. So that is also a known factor in cesarean deliveries. However, you must always first discuss your birth delivery options with your doctor, because you must be prepared for either. If you are well prepared and you keep an open mind, this is something which will not really happen. Apart from that, also remember that discuss everything with your doctor. Have a have a birth plan in place, because a birth plan will actually help you to prepare yourself mentally. Last but not the least, a lot of times doctors are also said that they are maligned, or they are said that they've become money making machines. They do cesareans where normal deliveries can be done. Most people who are ethical will not resort to a cesarean where a normal delivery is possible. So I believe that always have this journey of trust with your doctor. Talk out everything with your doctor. Make sure that you know what are your particular problems and what are the emergencies which may arise during the time of labor, so that you are more prepared just in case a cesarean delivery is required. Have trust and faith, and always remember that cesareans, whatever be the reason, if they are indicated, they can definitely save lives. So, normal delivery, natural delivery is definitely something that we propagate and we all want for our patients. But of course, where required, one should not hesitate in doing a cesarean delivery as well.